Hi, my name is Reagan Wyatt, and the key structure of the lymphatic system that I have decided to discuss is the spleen, right here in the purple. The spleen is a lymphatic organ or a massive lymph node located in the upper abdomen behind the stomach, which is seen here in the pink. The spleen functions to filter the blood of debris and old red blood cells and also acts as a storage site for lymphocytes. So as you can see here, we have a more detailed image of the spleen. I'm gonna have to pull it in as I speak so you can see a little better. So the spleen is surrounded by a dense connective tissue capsule here in the purple and then again here. From this capsule, connective tissue strands called trabecula extend into the spleen. They're the little purple lines here. The spleen is composed of two types of lymphatic tissue. White pulp and the little white dots, and red pulp are the surrounding areas in red. So moving on, we're going to move down to the more detailed view of the white pulp. White pulp consists of lymphocytes and macrophages that are clustered around small splenic artery branches called central arteries. As you can see up here, I've drawn the splenic arteries in the red and the splenic veins in the blue. So the lymphocytes and macrophages are going to cluster around the red splenic arteries. So the lymphocytes perform immune functions and the macrophages destroy blood-borne pathogens. So that is the significance of the white pulp in the spleen. So moving on to the red pulp, can you see it here? Red pulp consists of splenic cords composed of reticular fibers, fibroblasts, red blood cells, macrophages, lymphocytes, plasma cells, and granulocytes. As you can see there, macrophages in red pulp clean the blood, removing defective blood cells and debris, so it filters the blood. And then additionally, the spleen produces blood cells that store platelets in red pulp. So platelets are also stored here in the red pulp. Let's zoom out so you can get a good view of everything. Okay. The clinical application I've decided to discuss for the lymphatic system is Hodgkin's disease, also known as Hodgkin's lymphoma. Hodgkin's disease is a certain type of lymphoma in which cancer originates from a certain type of white blood cells called lymphocytes. In a healthy person, the lymphatic system clears infection and keeps body fluids in balance. In a person suffering from Hodgkin's disease or Hodgkin's lymphoma, B lymphocytes start to multiply abnormally and begin to collect in certain parts of the lymphatic system. The affected lymphocytes lose their infection-fighting properties, making you more susceptible to get other types of infections. Throughout this assignment, I've learned more about the spleen and Hodgkin's disease, helping enhance my overall knowledge of the lymphatic system. This newly learned knowledge is significant because it has taught me the significance and importance of the spleen. Even though you can live without your spleen, it is crucial when it comes to your body's ability to fighting off infections. Without it, you are much more susceptible to contracting dangerous and deadly diseases and infections. The knowledge I learned about Hodgkin's lymphoma is also significant because it has taught me how the body reacts to being under attack. Being that I have decided to pursue a career in nursing, knowing how the body works is part of my job. So understanding that the spleen plays a vital role in fighting infections is vital for furthering my academic career. It is also vital that I understand how the body and the lymphatic system in particular reacts to being under attack, considering I will treat patients who are suffering from conditions similar to Hodgkin's lymphoma. Thank you.